Hey there, Dr. Janelle Louis here. And if we haven't met yet, I'm a licensed naturopathic doctor and a board-certified psychiatric mental health nurse practitioner. And I am passionate about helping Seventh-day Adventists to systematically integrate the science and art of Christ's method of healing with the three angels' messages in order to reach souls for the kingdom. Now, in Medical Ministry, page 325, it says the following. It says, "It is the Lord's purpose that his method of healing without drugs shall be brought into prominence in every large city through our medical institutions." Now, if we are being honest with ourselves, we would have to admit that while there are a few beacons of hope in a few cities that are championing Christ's method of drugless healing, we are a far cry from seeing the realization of the Lord's purpose. And this is just simply looking at physical health. Now, when we talk about mental health, we're even farther from the fulfillment of this purpose, of this quotation. We'd be hard pressed to find even 5 institutions that are placing a significant emphasis on mental health, and specifically integrative mental health or holistic mental health, using Christ's method, the method that he has personally revealed to our denomination. And yet, we have historical data that tells us that mental health was a significant part of our health message in its early days. And so as I was thinking about these things and meditating on these things, praying about these things, the Lord began to impress me to create a training program for Seventh-day Adventist healthcare professionals that taught how to utilize Christ's method of healing to help people experience optimal mental and physical wellness. Okay, so for the past 2 months or so, I have been meeting with different healthcare professionals and talking with them about what they wish that they could have learned, where their knowledge gaps are, and just kind of what their training entailed and what is holding them back from implementing Christ's method. And so we have gathered some really useful data, and we have used this data to put together a comprehensive training course, a training program that addresses integrative mental health and that is designed to teach Seventh-day Adventist healthcare professionals how to take a functional medicine approach, a naturopathic approach to helping individuals optimize their mental health, okay? And so historically, the type of healthcare professional that has taken our courses, we've had several nurses and nurse practitioners take our course, our program, the current course that we run. However, this program is open to any type of healthcare professional. So whether you're a medical doctor, a DO, a PA, a physical therapist, an occupational therapist, a respiratory therapist, or even a health coach, if this sounds like something that the Lord has been impressing you that you need to be a part of, then I want you to keep watching this video, because in a little bit, what I'm going to do is I'm going to share my screen and I'm going to start going through the details of the program, okay? So this is going to be a 20-week program. It's going to be virtually delivered. And right now, we are looking for a few beta testers to go through the program for the first run, okay? And so as you continue watching this video and you learn about the program, after you finish, if this sounds like something that you believe the Lord is calling you to be a part of, then what I want you to do is there are 2 links beneath this video. What I'll have you do is, if this sounds like, you know, what you've been searching for and you're ready to sign up, then go ahead and click the link to sign up, okay? If this sounds like something that you would be interested in, but you have a few questions, there's also a link for you to click so that you can book a brief call with us and get your questions answered before you sign up, okay? So what I'll have you do is continue watching the video, and at the end, if you are convinced that this is something that the Lord would have you be a part of, if you believe that the Lord would have you to be a part of this movement, then I want you to click one of the 2 links below this video, and we'll be in touch, okay? So what I'm gonna do is I'm gonna go ahead and share my screen, and I'm gonna start revealing or introducing you to the ReMIND Intensive. All right, so here we are. I'm sharing my screen, and I'm just gonna go over the details of the ReMIND Intensive. So the ReMIND Intensive is a 20-week intensive in Christ-centered root cause mental health for Seventh-day Adventist healthcare professionals. At the heart of ReMIND is the belief that true mental healing involves more than just managing symptoms. It requires spiritual transformation. This program equips you to not only treat mental health challenges at their root, but also to gently lead your patients and clients to the wonderful counselor who alone offers full restoration of mind, body, and spirit. Okay, so we've divided the ReMIND Intensive into 9 modules, and I'm going to go over each module and just kind of share what each one entails. Okay, so in our first module, this is our Illuminate module, we will be discovering the spiritual and scientific foundations of Seventh-day Adventist whole person mental health. So in this module, we'll talk about our call and purpose. We'll talk about the philosophy of healing that Jesus gave to our church for our Seventh-day Adventist health work. We will talk about integrating the gospel and health. We'll talk about true and false methods of healing. We'll talk about the role of spiritualism in the last days. And we'll also talk about the 4 different categories of causative factors for mental health concerns. Okay, in the second module, which is our Investigate module, we're going to master the biopsychosocial-spiritual assessment and the balance framework in order to help uncover and address hidden contributing factors to mental illness. So in this module, we'll be talking about, we learn how to effectively take a case. We will talk about the whole health inventory and learn how to use that. And this is the biopsychosocial-spiritual assessment that I use with my patients. We will also learn how to assess for suicidality and how to do crisis safety planning. We will talk about when to refer a patient for inpatient hospitalization. We'll talk about what to teach them to expect when they go inpatient. We'll also talk about the balance framework, which is a means of assessing and intervening in patients who are experiencing various physical and mental health concerns that I've used in my practice since 2016 with good effect. So I'm going to teach you guys how to use the balance framework. And we're also going to talk about the laws of health in relation to mental health. All right, so in the next module, module 3, our Interpret module, we're going to learn how to read and explain conventional and functional lab results related to mental health by using optimal ranges. So you'll know that when you go to your doctor, you typically have blood work done. And when you have that blood work done, there are reference ranges on the printout, on the lab result sheet. Okay, so these reference ranges basically say, hey, if your number falls between this number and this number, then you're probably fairly healthy. You're probably decently healthy, okay? But we all know, I'm pretty sure that you know someone who has gone to many doctors and been told everything's normal, but yet they feel terrible. So what we're going to be learning how to do is go over, like, use conventional blood work, but use optimal ranges in order to help a person optimize their health so that they're not just surviving, but they're thriving. Okay, so we're going to learn the optimal ranges for various conventional blood work, laboratory tests. And then we're also going to learn how to run and interpret functional medicine testing. So when I say functional medicine testing, I mean tests that look at things like genetics and genomics, gut health, reproductive hormones, organic acids testing, and also environmental toxicity. Okay, so this is what we're going to learn how to do in the Interpret module. In the Integrate module, we're going to learn how and when to implement therapeutic nutrition, circadian support, exercise, sleep protocols, and trauma-informed strategies for lasting change. Now, in this module, we're going to do an introduction to rational therapies. We're going to talk about therapeutic nutrition, including macro and micronutrients. We're going to learn how to implement my elimination and challenge protocol that I use with patients. We're going to study principles of hydrotherapy, and also we're going to learn more about environmental toxin exposure in this module. In the 5th module, which is our Intervene module, we're going to gain an evidence-based understanding of the systematic use of herbs and other nutraceuticals in mental health. This includes looking at drug-herb interactions, okay, because this is very important. Okay, so in this module, we are going to learn how to determine the quality of herbs and nutraceuticals. We're going to learn how to evaluate research. We're going to learn how to customize an herbal formulation for a patient. And we're also going to look at some very important nutraceuticals for mental well-being, including when and how to use them. All right, so in Module 6, our individualized module, this is our most extensive module. And in this module, we're going to strengthen our knowledge of psychopathology and use it to tailor action plans based on unique client presentations and also root cause contributing factors. So in this module, what we're going to do is go over each of the different categories of mental health concerns in the DSM-5. And for each of those categories, we're going to go more in depth on the different actual diagnoses in each category. So when I say the categories, the things that I'm talking about are anxiety spectrum disorders, mood disorders, obsessive compulsive and related disorders, trauma-related disorders, schizophrenia spectrum and other psychotic disorders, feeding and eating disorders, somatic symptom and related disorders, substance use and behavioral addictions, ADHD and autism spectrum disorders, sleep-wake disorders, and neurocognitive disorders. So we're going to go over each of those categories and the diagnoses within each of those categories. And we're also going to, for each of those categories, we're going to talk about the relevant anatomy and physiology. We're going to talk about the pathophysiology, common pharmaceutical interventions, botanical and nutraceutical interventions that can be utilized, therapeutic nutritional interventions, physical medicine interventions, so things like hydrotherapy, and also we're going to have a sample action plan for each of the diagnoses that we go over. Okay, and again, this is our individualized module. All right, so in our 7th module, which is our influence module, we are going to deepen our understanding of the professional's role as a spiritual guide by learning how to counsel and support clients through spiritual struggles, okay? So here we're going to be looking at relevant cognitive behavioral therapy principles. So this includes things like thoughts and their impact on behavior. We're going to look at maladaptive schemas, so behaviors that may have been adaptive when we were younger, and they may have helped us deal with painful situations then, but when we grow up, these behaviors become maladaptive and they cause problems in our relationships. They can even affect our health because of their effects on our thoughts and our physical bodies. And they also, in addition to affecting our relationships with each other, they also can negatively impact our relationships with God. So we're going to look at how these things may be affecting our clients and how we can help them navigate these situations. We're also going to look at the 5 core emotional needs. We're going to look at child modes. We're going to look at the principles of behavioral control. And then in this module, we'll also be looking at spiritual warfare. So I will share some of the science that supports the idea that there's a spiritual role. Not every mental illness is due to demon possession, but there is a role that spiritualism plays in some cases of mental illness. And so while I go over the science, we're going to have some guest speakers who will go over and talk about their actual experience and how they address these type of spiritual manifestations. Okay, and then we are also going to talk about how to help clients through grief, guilt, unforgiveness, and other negative emotions in this module. So in our 8th module, our Initiate Change module, we're going to learn how and when to support clients in safely tapering psychiatric medication. And we're also going to look at how to collaborate with prescribers. Okay, so in this module, we'll be looking at psychopharmacology. We'll be looking at the various medications that are prescribed for to address mental health concerns. And we will learn about notable features of each drug class and also the common side effects of each drug class and how we can manage those using integrative methods. All right, and in our final module, our Inspire Transformation module, we are going to gain the tools necessary to support long-term mental, emotional, and spiritual transformation. And we're going to learn to maintain a Christ-centered, ethically sound, evidence-based healing practice, okay? And so basically what we're going to go over in this module is how to create a follow-up plan for your clients and we're going to look at various models rather of entrepreneurship. So we're going to look at how you can use the information that you have learned throughout this program to start a business or a ministry or some means whereby you can put this knowledge into practice in order to help individuals improve their physical, mental, spiritual, and social health, and also ultimately to help individuals be drawn closer to Christ, okay, because that's our goal. All right, so those are the details of the ReMIND intensive that I wanted to share with you. If this sounds like something that you would be interested in, and you think you would be interested in being a beta tester for our program, which is starting July 21st, 2025, then there's going to be buttons or links below this video. There's going to be a button to sign up if you want to go ahead and register, or if you still have questions and you'd like to book a short call with me or a member of our team, then go ahead and click the other link and you'll be able to schedule a call to have your questions answered before signing up. So I am looking forward to connecting with you, and I pray that the Lord will bless you always.